I'm going to come around the table to this other side. And what I'm going to do is now check the line down here, bring that there. Again, from this position, just check the general move, and then I'm going to bring this up to about 90 degrees. What I'm going to do here then is check how the tibia rotates, how the ankle moves in this position or doesn't move, and the restriction to torsion and rotation. Bring this one up. A lot more motion on this side in rotation. We're going to quickly just check recoil test. She moves on this SIJ. There's work on this SIJ to do. So we come down with permission and work through the gluteals. The two main aspects besides the fascia of the glute maximus is going to be the sciatic nerve, and that's your notch. And if your skin moves both directions freely, you have a gliding nerve. It does not. So it moves up and doesn't move down. So it's the nerves being pulled up, that makes sense, being pulled up a bit by this lower back. The other is the sacrotuberous ligament. So as we step off the side of that nerve, we also still have a tight ligament. That's an extension of your hamstring going up through the back line to the sacrum and the thoracic. So that may need to be worked. But for today, what we're going to do is leave that alone for a second and check now the popliteus and the plantaris. Your popliteus does a more oblique orientation, and you'll feel me on it right about there. Your plantaris is a little more centered. You got to watch, you have the tibial nerve here, and then it has a really fine little, you'll feel as I'm trying to find that long tendon when we take the gastroc out, that sits over the soleus, and that's it going down through there. The other thing we want to think about is the knee capsule and the joint, and the tib posterior muscle, which is the medial malleolus. And so she's thick as a brick here. This will be tender up that line. I have to sink around, so in order to, so I have to decide what I'm going to do first. Am I going to do knee capsule or tib posterior? Based on the tension, I'll always take the easy compensation first and clear that before I go after the tight one. So it would be the knee capsule. So this is what's called, this is an orthopedic test called Apley Squish. And aptly said, it takes care of if there's a problem as a special test for meniscus or ligament. Generally speaking, it's going to be painful. If it's not painful, then it's a joint compression, which we can utilize. So what we're going to do is I'm holding the hamstrings, gathering the fascial sleeve inward, putting a fingertip on both tendinous junctions. I'm going to push pressure down and pump. Pressure down and pump. Let it sit for a second. Let her body respond. Step one. Step two, I'm going to pick it back up, it moves better, and I'm going to engage the ease rotational barrier. It happens to be external. I'm now going to push down again and pump with the ease barrier. You can feel the change in that. I put it down and we wait. We come back, and all of a sudden, what we did at the knee capsule, not using neurofascial mobilization glide as a benchmark, but not a technique, we've changed the sciatic nerve. That's what I mean, the interface. The nerve can change it if you do put your intention on the nerve, but the capsule can change it. So that's the beauty of when you benchmark. Oh, that's different. And we have a lot more motion. So that now I could do a little bit of just, my muscle technique's pretty basic. It's just pin and shifts. So I'll find that sore muscle, I'll put pressure on it, and I'll usually move in an ease direction and then move by. If you roll the knee, you're looking now at ligaments, the collateral ligaments. So I may just move it like that. That'll relax the lateral collateral. And there we're getting even more motion, so then we're going to turn you back over.